I'd much rather try this procedure than going in and putting nuts and bolts in my back. 2010, in April, I had an accident at work. I got knocked off a dock, about 6 foot, and fell on my left side. Started off with some pain in my back, and progressively got worse week after week. Basically started from my back, went all the way down my leg, all the way to the heel, to the arch of my foot. I kind of roughed it through the time with all the pain, and until finally my back gave out at work, and the ambulance had to come get me. Basically, my pain scale was it stayed at a 7 and 8, and basically at times was a 10 and plus when I couldn't move and couldn't sleep. Basically, the medication, I was on 4 different medications. It was I can't explain the pain. All that I know was that that it affected my whole family, and yeah, I don't know if anybody really understands how much pain it is until they go through something like this. None of the medication basically really worked. It just basically worked for maybe like 15-20 minutes, and the pain would just continuously go down my left side of my leg. I couldn't do nothing. I mean, I was laying on the couch or laying on my bed. Couldn't do anything. Couldn't do any sporting events with my son. He was in baseball at the time and in basketball. Couldn't. Basically, for 16 months, I've not been able to do anything with my son. So the work comp doctor, from the injury at work, they sent me to a clinic, which they sent me to get an MRI. Basically, told me that I needed to see a specialist for my injuries, and it was a workman's comp accident, and they gave me the choice of like 6 doctors in Orlando, because I live in Orlando. Dr. Duke did have an office there, and it was kind of close to where I lived at, and but the lady said the doctor was awesome, and so I said, sure, I'll go see him. You know, this was only going to be like maybe a 1/2-inch incision, that I was actually going to come here and at the facility in Titusville or Viera, and he said that it would basically take 45 minutes to proceed, to do the procedure, and I'd be able to go back home. I arrived here at 9 o'clock. Talked about the procedures with the doctor. Spent an hour here getting ready, getting the IVs. Basically at 2 o'clock, I was on my way back home. Got home, relaxed, was sitting in my bed, was able to move around and walk around. And it was incredible that the pain was gone from basically the procedure that was done 2 hours ago.
Mr. Lawson, how you doing?
Yeah, Dr. Duke.
Good to see you. So you're what now, 2 weeks out from your surgery in your back for the laser surgery, Duke Laser Disc Repair, at L34 and L45.
Yes, sir.
How you doing?
Doing probably like 90% better.
Great. Wow, this soon after surgery.
Yes, sir. Pain's
And-
all gone from the leg, so.
Pain in the leg is 100% gone, and your back pain, a little bit of soreness around the incision,
Yes, sir.
and that's normal to be expected. That's the muscles, they're still healing from the surgery. Can I take a look at your back?
Definitely.
Now remember, you had a laminectomy done in the past,
Yes, sir.
and so you injured your back again at work in that same area as your prior injury, and then we went in 2 weeks ago and did the surgery here where we repaired the 2 discs at L34 and L45 that were damaged. You still have your steri strips on here. You mind if I peel these off? I think it's time for them to come off. All right, the incision looks fantastic. It's just a little bit swollen still on the side, and it's tender here.
Yes, sir.
Yeah, and that tenderness is from the surgery. That will get better in time. You're a muscular guy, and so you have a lot of muscle here. We had to go through that muscle to get to the spine, and that's normal to have some tenderness. But the incision itself is healing beautifully. Do you have any more pain in here where the discs were damaged that you used to have pain?
No, sir.
So that pain is gone, your leg pain's gone. I think the surgery has been a success. You're going to continue to get better in this area.
I didn't have the pain going down my leg. That was my major problem. Mostly all my pain that I had was going down my whole leg, through my groin, to my kneecap, to the bottom of my foot. And after that procedure, it was gone. I was thinking about all the things I was going to be able to do again from that 3 hours ago, 4 hours ago. But when I first walked in here, and I was in excruciating pain and couldn't hardly walk, and basically 3 hours after the procedure, walking, I don't have any pain, and just thinking about the things I'm going to be able to do that I was not being able to do for 16 months. I can't say in words how happy I am, and to express to Dr. Duke. You know, I can write him a letter, I can say thank you, but I don't know if he'll ever realize what he has done for me, for the side of my family side, and my personal life, getting back to from where I was at. I was in a hole, and he's been able to pull me out of the hole.